Welcome back, you guys. Menopause Energized 30-day healthy heart marathon. We're on day number 7. Stress, menopause, and estrogen. What is the link? Continue to watch. Hello, everyone. Welcome back to day 7 of the Menopause Energized program, the 30-day healthy health marathon. Did you know that stress, menopause, and estrogen is linked together? Stress does affect the heart if it is chronic, and the risk is even higher in the menopausal years because of the estrogen dive. So let's dive right into it and talk about the link and things that you possibly may not or may not have been aware of. Stick around to the end because I will give you one big tip. Remember, in this program, I always said each day you will walk away with a tip that you can start today to help manage your challenges through your menopause journey. At the end, I will give you one big tip that is like the foundation to start managing your stress levels. So today we're going to talk about how the cortisol reacts on the body. The cortisol is the one that when we get upset, it gets released in the body. If you're having a stressful situation in your life, it could be on a job, it could be an illness, it could be that you have so many things to do in one day, you don't know how you're going to get it all in. Stress comes from a lot of different combination of things in life. And what cortisol does, we'll talk about in a second what it does, but we want to talk about the estrogen level because it plays a big role in the menopausal years. So with the cortisol, you have the estrogen. They work together, but they don't work together for the good. Because what happens is when the estrogen level drops in the menopausal years, the estrogen is the one that controls and balances the cortisol. So when the estrogen level drops in the menopausal years and the cortisol level is up, it's not going to help to balance it out. So we're not going to have that estrogen there to help us balance the cortisol level. And the reason why that's important is because when you're in a stressful situation, that cortisol, when it's being released because of that stressful situation, it increases your heart rate, it increases your blood pressure, and it increases your breathing. When the amounts of estrogen is decreased, it doesn't help to bring those cortisol levels back to normal. Now, when the estrogen is in place, when there is a normal amount of estrogen there before we go into our menopausal years, you got enough estrogen there to decrease the heart rate, you got enough there to decrease the blood pressure and slow down your breathing. So when it is a right amount of estrogen there, it will decrease all this. This is a normal response. When your levels go up, it's actually protecting you when it's temporarily. So those cortisol levels is okay when it's high, a temporary phase, because the estrogen is going to kick in and balance it out. The problem comes in when the cortisol level increases and the estrogen is not there as much anymore because we are in our menopausal phase. Remember, we talked about it in the beginning. A lot of our symptoms come from the estrogen dropping. Again, we're not at war with our hormones because they're not attacking us, they're just leaving us. So what happens when your cortisol level is high? When it's high is when you say under a lot of stress that's chronic. Say every day you got something going on. It may be a loss of a job. It may be health illness. You may be taking care of a loved one. Like I said, it can come in many different things. At that point, you really don't know how to handle your stress because there's a lot going on. But what's going on in your body is that cortisol level remains high, especially if it's chronic. And the estrogen level is not there enough to balance it out completely. The danger comes in is that when you have chronic stress, you're going to have chronic cortisol levels high in your body. Temporarily, it's a protector. But when it's chronic and you consistently have stress and that cortisol level stay high, that's when the problem happens. That's when the heart comes into link with that. Because what happened is that over time, you can actually develop high blood pressure because cortisol in your body also can cause a lot of other things, but we're only talking about the heart today. It can cause responsible for some fat deposit in your body. So you hear people say when they're under stress they gain weight. So it deposits fat deposit there because of course they're going to eat. Some people eat more when they're under stress, and so that's the definition behind that or the meaning behind that. But with chronic stress, you're going to have increased cortisol level over time. If it stays there, you have a possibility. And this is all research. Research shows this that it can increase your chance of having high blood pressure. It can increase your chance of having persistent palpitations. And again, remember I talked about the breathing and stuff, but that usually comes with anxiety, um, panic attack. Sometimes that's when the breathing comes in or the shortness of breath. And then, so with that being said, what does that say? As we went back into the beginning of our program, it increases your risk of heart disease. It increases your risk of heart disease because remember we talked about a few sessions back, when you have long-standing high blood pressure, it can affect your heart because you're constricting your arteries. You're not getting enough blood flow back into the heart because of the constricted arteries due to the high blood pressure, and that could be the beginning of heart disease. Again, I said this and I'll say it over and over again. I teach this because women have the cardiovascular disease. Cardiovascular disease is the number one killer in women. And again, I tell people, why do I teach this? Because as a registered nurse for over 30 years of experience, my specialty was and still is cardiac. So I did I have a lot of cardiac experience, open heart step down, the ER, the CCU, the IMC, and then the regular, of course, progressive care unit. And not only was that my specialty, I went into that, or I put it this way, I stayed there once I got there because I realized that that was my passion. So we're going to go to that number one tip I told you about here. But we're just going to go over a couple little things first. Stress can lead to anxiety. Some people call them panic attacks. There is a little difference. We won't go into that. I go into that more into the upcoming 8-week coaching program. But for tips, the breathing exercises is your number one tip for today. Start out with that, although there are a lot of other things as well that can help with managing stress. To me, this sets the foundation because the breathing exercises helps to lower your blood pressure, lower your heart rate. It calms the cortisol spikes, you guys. It brings those cortisol spikes down. Not only that, the breathing exercises has immediate benefits, especially when you have the one on demand, when you have that on-demand stress or panic attack. Breathing exercises. If you don't realize this, sometimes when you're at work and you're or anything and you're busy, we don't realize we're not breathing the way we should. We're not paying attention to our bodies. Are we taking in a nice deep breath during the day? Nope, we're not, because I notice that sometimes with myself. And I'm like, am I really breathing? And that's because we are so busy, we're not actually giving our body a chance to just absorb in the oxygen. When you breathe more oxygen from the air into your lungs, it helps with the circulation. So during the day, remind yourself to take some nice deep breaths. I'm going to show you this breathing exercise in just a few minutes, but to take some nice deep breaths. It really does help. And then also for the breathing exercises, the one that I'm going to show you, really simple. You can do it. It's nice if you could do it once a day, or you could do it twice a day, once in the morning and once at night. Research shows it does help you get a more restful night of sleep. You do it for 2 to 3 minutes. And if you're around, you can close your eyes, have nice thoughts, or calm music. But what you do, if you're right-handed, of course, you put your right hand on your chest and you put your left hand on your belly. And what you do, and I'll demonstrate in a moment, you will take some nice deep breaths in through your nose for about 4 seconds, and you can feel the belly rise. And then what you do is you exhale for about 6 seconds, just slowly, and just exhale. And you exhale through your mouth. So that's the way you do it. Hand here, lower hand here. You inhale through your nose for about 4 seconds, and then go ahead and exhale slowly for about 6 seconds through your mouth. Let's demonstrate this real quickly with some music. Let's try to get the music in there and see if we can do it with the music. Close your eyes and nice thoughts. So let's try it with the music. Here we go. We're going to do some breathing exercise. Close your eyes. Think good thoughts. Breathe in through your nose for about 4 seconds. Exhale slowly through your mouth. Breathe in. Exhale. Breathe in. Exhale. So you get what I'm saying? These exercises really do help. Again, not only does research show it, I use these as well, and it does help. I do have some anxiety every now and then, which is much better than what it was because I've learned so much more since then. Not only that, it helps you for the on-the-spot demand. Because you're used to doing these breathing exercises that I feel is already going to help you, when you get that, feel like you're getting some anxiety rising up, or some people do have panic attacks, put it into action right away. Another thing I want to tell you, if you ever see it out on the scene or in the movies where somebody is having a panic attack or they upset and the person tells them, well, calm down, everything will be okay. They really don't want to hear that because we don't know what's going on in their life. We really don't. So a lot of times they don't respond to that. But you also can help someone else. And I find, because I do it with my patients, when I was doing bedside nursing, I'm doing all health coaching now. But when I did bedside nursing and they would get upset or have an anxiety attack, telling them instead of calm down, everything will be okay, is not what they really want to hear. But a lot of them, if you tell them, we're going to get through this moment right now because we don't know what's going on and that was going on in their past. So we're going to help you right now. Let's do these breathing exercises together. This helps. It will help calm you down. And you demonstrate to them how to do these breathing exercises. And I find that helps more than patting somebody on the back, telling them, calm down, you'll be okay. That really does not work. So that is the biggest tip I have for today. I won't keep you holding on too long. I'm going to surprise you again. Stay tuned for day 8. If I haven't lost track, stay tuned for day 8. More to come on keeping a healthy heart with this 30-day Healthy Heart Marathon. Until then, what do I always do? Take care of your heart. See you next time.